Is pain during sex normal?
No, painful sex does not stop at lubrication. It's a lot of things that you need to check, you need to know about painful sex. You need to explore to know if the cause of your painful sex is just has to do with lack of lubrication.
What's Kayamata?
You Google it. They are sex enhancers, so to say. People just sit in their house and concoct all kinds of things and say, take it, it's going to increase your libido, put it there, and yeah, just a candidate for a lot of things in the future. Now, one issue we have is that everybody wants to appear holy to the other partner, so they do not want to share that this is what I enjoy most. Because the question is, how did you know?
Hello, beautiful people. Before we begin, take a slow breath in and exhale gently. Place one hand on your heart, one on your lower belly, and whisper, I'm here, I'm listening. Welcome to Our Body and Mind, a safe, open, and compassionate space where women's health meets real conversations that heal, blending expert insights with heartfelt stories. I'm your host, Dr. Tammy Lawson, aka Dr. Tammylicious. Last season, we explored the early stages of becoming a woman, the myths, the confusion, the pain, the silence, and the beautiful, complicated transition from girlhood. But now, we have grown. We have stepped into young womanhood. And with that comes new questions, new challenges, and a different kind of voice, the voice of the body. This season, our theme is When the Body Speaks. And today's episode is sensitive. It is important, and for some women watching or listening, it may feel very personal. Today, we'll discuss something many women experience but rarely talk about: pain before, during, or after sex. Is it normal? Is it something to endure? Is it spiritual? Or is it medical? I'll tell you a story about a newlywed. Her name is Sister Wazobia. She's 33. She became pregnant the same month she got married. Before pregnancy, intimacy wasn't completely painless, but it was manageable. She felt a little discomfort, yes, but she already had some knowledge about lubricants, and that helped. But a few weeks into her pregnancy, something changed. She started experiencing extreme dryness and pain. This time, lubricants didn't help. And because of the pain, she couldn't fulfill what she believed was her conjugal obligation. Her husband became unhappy, confused. He began to wonder, is she avoiding intimacy? Is it because she's pregnant? Is this how it is for other women? He had many questions, but no one to talk to. Sister Wazobia also had questions. She had read articles where some women said their libido increased during pregnancy, while others said it reduced. But this wasn't just low libido. Why the intense pain? She became worried. Quietly, she began to feel inadequate, unhappy, like she was failing in her role as a wife. But she had no one to talk to. She had never received sex education as a teenager, not as a young woman. She had never spoken to anyone about sex, not even a doctor. Even during premarital counseling, conversations around sex were avoided in an attempt to prevent fornication. So where does she start from? One day, she attended women's fellowship in her church for the first time as a married woman. That day's discussion was about godly marriage, and the highlight, satisfying your husband. When it was time for questions, she hesitated. Her heart was racing. She battled within herself. Should I ask? What if they judge me? But finally, she raised her hand. With a shaky voice, she asked about experiencing pain during intercourse as a pregnant woman, hoping to be guided by women who had walked the path before. But what she received was not guidance. She was told, open your legs very wide, put your mind into it, use lubricant and satisfy your husband. You are not well lubricated. That's why it hurts. And the room filled with laughter. In that moment, Sister Wazobia felt small, embarrassed, ashamed. She blamed herself for even asking. As she was leaving, another woman casually mentioned that she enjoyed sex the most during pregnancy. And she was pregnant. Out of curiosity, Sister Wazobia asked, are you serious? Hoping maybe she could learn something, but the woman laughed and walked away. Was she joking or mocking me? She wondered. She left that fellowship feeling worse than she came. That night, she tried again. She opened her legs wide. She put her mind into it. She used lubricant, but the pain was still there. So she endured silently because, after all, sex wasn't every day. Because, after all, a good wife satisfies her husband. But here is the question. Was she supposed to enjoy it? Or was her body speaking? Now, this is Sister Wazobia's story. But for others, it may look different. Some are virgin brides. Some are inexperienced. Some are dealing with unhealed trauma. And for some, it may be an underlying medical condition they don't even know exists. In part 1, we start with the body. If sex consistently hurts, we need medical clarity. So today, I'm joined by a reproductive health expert to help us understand, is pain during sex normal, especially in early marriage or pregnancy or even perimenopause? Dr. Uko Iko-Ojo Samuel, You're welcome to Our Body and Mind.
Thank you very much.
For the second time.
It's a pleasure to be here again.
All right. So Dr. Uko Iko-Ojo Samuel is an expert in reproductive health. He's the medical director and chief executive officer of GISD Hospital Limited, Abuja. Once again, Dr. Sam.
Yeah.
You're welcome.
Thank you very much.
Our Body and Mind.
Thank you. It's a pleasure to be here again. And
All
we have
right.
some interesting topics to discuss.
Yeah. I hope you're ready.
Let's get into it.
All right. So, Dr. Sam, many women, grow up thinking pain during sex is normal. Is pain during sex normal?
No.
It's not normal.
No, it's not normal.
So, what is the cause, or what are the causes?
Okay, allow me start this way. Sex is a behavioral act. Sex is also a culture. Why I would say sex is a culture is because different people, different sects, experience sex differently. Sex as a whole is supposed to be enjoyed, not endured. It's a process, it's an habit to some persons, and to some other person it's an act. It's like the story you gave is an act because you have to satisfy your partner, but ideally it's a behavior, it's a culture, it's a necessity. In some parlance, they say it's the fabric of every relationship between a man and a woman. Put it in that context. So painful sex as the topic is today, it forms part of a broader classification. We'll say it in a sense. We'll call them female sexual dysfunction. When use the English term dysfunction, I mean it's not going the right way. So it's a broader text, and it has to do with interest, stimulation, orgasm, and all of it. Particularly, we're talking about painful sex. Sorry, talking about painful sex. It means penetrative sex, which could be before penetration or during penetration or after penetration. And I'll walk you through the vast majority or examples of all of that. It could be at the point of entry when the vulva is too sensitive. It could be upon entry. It could be deep, and it could be as a result of so many things. You understand? So yeah, painful sex is not normal. It's not normal. So, and there are underlying factors. The reason why we call them sexual dysfunction because the factors could be physical, could be psychological, could be psychosocial. It could be as a result of interest. It could be a bit of psychosocial brings the mental part of it into it. So yeah, sex as a whole, most times to leave out the major organ of sex. Major organ of sex is the mind. It's not the genital organs as we take it to be because the mind has to be there also. So it's a pointer to a vast majority of ailments. It could be gynecological, it could be endocrinological. People with thyroid disease sometimes have low libido and all of that. And it could be hormonal imbalance in some cases. So yeah, so let's go bit by bit so that we don't lose the people.
Okay. So, I know painful sex to be dyspareunia.
Yes.
Is it what you just explained as a disorder, or
Yeah,
is part of the disorder?
it's part of it. That's
Okay.
painful sex is forms part of a broader classification. So we're taking painful sex as part of female sexual disorder.
Oh,
So we'll just dwell on painful sex for now.
okay. How common is it?
Well, as a criterion, meaning that based on statistics available, and it's very difficult to get good statistics for painful sex because it depends on who you ask and people you just interact with. So say it's 10% of general population, but for postmenopausal women, it's 75%. Age is 51 to 59 particularly. And one of the reasons why it is that prevalent in postmenopausal women is because at that age, she's not ashamed to speak about it. If an adolescent comes to the hospital and says, I'm having painful sex, like, what are you doing having sex?
How old are you? Are you
You
married?
cannot open up to a parent to say, but that age, you've experienced non-painful sex, you understand that this is not painful. Except for people who have sex with who are first timers or having sex or virgins, at that point in time, it's expected that they feel some form of pain at that point in time, but then they go on to enjoy the process. So yeah, so it's a 10% as a criterion, 75% for postmenopausal women, which would dwell mainly on symptoms because they experience symptoms of painful sex.
So I should start preparing my mind for 50.
Yes.
Yes. Are you scaring me?
No, don't worry, we're here for you.
Okay, let's talk about lubricants. I bet, as simple as it may sound, a lot of women are not aware of it. There are different types of lubricants for women. We have the water-based, right, Dr. Sam? The
Yeah,
oil-based, we have aloe vera, and then we have one, no, saliva.
natural.
We have the saliva-based, in quotes.
Yeah.
Okay, so tell us more about them.
Okay. For lubricants help a form of. Okay, now let me rephrase. Lubricant help when the cause of painful sex has to do with vaginal dryness.
Okay.
Understand? Has to do with vaginal dryness. So there's in medicine say atrophy. There's some form of loss of tone in the vagina, which is supposed to help in producing the natural lubricant that will help with sex. You understand? So, but then in some persons, due to certain factors, that is present, is prevalent. There's vaginal dryness. So, with vaginal dryness, sex will be painful because there's no good stimulation. There's no stimulation. So sex is painful. So we encourage people to use lubricant in that moment because it will help. The friction, there's no friction. When there's friction, there's bruises and all of that. So that's why what brings to the after sex part where you have bruises after sex. So you have pain after sex because of the bruises and all of that. So lubricants help with lubrication. Now, ideally, lubricants should contain non-harmful substances. In the same we should mention some are oil-based, and some are aloe vera-based, and sometimes we also have moisturizers, which are water-based. Just help to provide moisture to the environment, and it helps penetrative sex and reduces the pain which these people experience. So yeah, lubricants, which are FDA approved, that have been approved by the right agencies, and say FDA approved, and are good. They're good. We encourage patients to use them to help the experience. In some persons, they use lubricant and that as well, but it doesn't stop at lubrication. Painful sex does not stop at lubrication. It's a lot of things that you need to check, you need to know about painful sex. You need to explore to know if the cause of your painful sex is just has to do with lack of lubrication. So you use lubricants. Okay, you use lubricant to help. And that's the first thing everybody does when they have painful sex. Every woman does when she has painful sex. I think it's an issue with vaginal dryness. You go to the pharmacy and get all types of lubricants.
Yes, that's even the next question. What type of lubricant is recommended? Because, like you said, you just walk into any medicine store and just get anything. But we know that some are better than some. So what kind of women can use the water based, the oil based, or some other type?
Okay. It's not in our place to recommend the type of lubricant that you use. What we'll tell you is, most times, that when you go to get a lubricant, you should read and see the constituents. Now, we mentioned the basic constituents, or in layman term, ingredients in making a lubricant. Most times, oil, and it's an aloe vera and water base. You shouldn't have other substances that are harmful to the body.
Okay.
And you should always check for the FDA approved tag for lubricants. It's a Nigerian, so we say check for NAFDAC number if it's approved by NAFDAC. And if it's a foreign product, check for the FDA approved tag, because they'll go under a lot of scrutiny for them to be approved. Is every day we keep on seeing new lubricants. People come to the hospital with different kinds of lubricants, some we've never seen before. And how do we know? We just take and read and see some things that, like, this should not be in a lubricant in this stand. So there are a lot of things that we would see in a lubricant, I will tell you do not use. The most common lubricant is the KY jelly, which has been approved by FDA, is common everywhere in this stand. So, and you can use that. Most of the other lubricants available, some condom brands have that. Now, you should not confuse lubricants with what they call kayamata or what is that. It's not the same. They're not the same. Those ones contain harmful chemicals. You
What's
don't know.
kayamata?
You Google it. They are sex enhancers, so to say.
Google, what's kayamata?
So they are sex enhancers, and people just sit in their house and concoct all kinds of things and say, take it, it's going to increase your libido, put it there, and just a candidate for a lot of things in the future. Understand? So yeah,
It's a big market.
yeah, people love it.
Okay, so I was thinking that for women trying to get pregnant, they'll have a particular type of lubricant, and then for people that are using, for example, condom, there'll be a different type of lubricant. Because I think said if you're using condom, the oil based is not the best option. Or can you help us clarify that?
Okay, yeah. For condoms, you should use moisturizers because condoms already have oil on them. You understand? Condoms already have oil on them already, so you choose moisturizers. And some of these products have lubricants also, which you can use. So now, particularly for the ones there are lubricants where it is stated categorically there that you do not use in pregnancy and all of that because they have some chemicals or drugs that are not safe in pregnancy. Some of them
It's been
have
said.
yeah. Some of them have enhancement medications in them, in understand, which are not really safe in pregnancy. So yeah, so no, we did not dissect what causes of painful sex. Yes,
Yes, I was going to ask next
okay,
because you gave a broad view of what the causes could
maybe
be.
yeah.
So now I want us to narrow down. So, what are the likely physical causes of painful sex?
Yeah, okay. So for common causes, let's start from the exterior inward now. The something called vulvodynia. What it means is there's some form of sensitivity on the vulva for unknown reason.
Idio-
Idiopathic,
idiopathic.
yes, for some persons. So yeah, some other people it could be as a result of inflammatory response in the vulva area. In this sense, so some people experience that. So people who have vulvodynia, for example, when you use lubricant, sometimes it doesn't do anything. It doesn't do anything for them. In this sense, so if we try lubricant, try antibiotics sometimes because it could be as a result of an inflammatory response from infection, STIs, and you're unable to get rid of it, we'll now counsel them for surgery. So take away the vulvar lip. So for most persons, after that, that's all. And that cause of painful sex is lack of knowledge about sex. Like you said, for example, I'll assume Sister Bassi or Madame Bassi did not have any prior knowledge of sex, or no sex education and all that. And probably her partner was also naive, also that. So now you know that I've had people come and complain of painful sex and wife not enjoying, and we have to counsel them and they ask, how do you make love? It's like, what's that? Lie down, open your legs. And they start. So that woman is going to have painful sex, definitely, because there's no form of foreplay, there's no stimulation, her mind is not into it. So she's not going to be well lubricated.
But the men, I don't think they know what foreplay is. All they know is lie down, open your legs as wide as you can.
Yes, like I said, sex is a culture. Sex is a culture. Now, in the African culture, foreplay is not as it's where you see. You understand? Because in African culture, it's that if you want to have sex, you want to have sex. Do you understand? You just have to find a way as a woman for you to be into it. You understand? African culture is they play around the palm tree and they're in the mood. Or you get that's how it is in the African culture. From some other culture, it's not that way. They start kissing themselves, caressing themselves, and they get into it. Stimulation, basically. So different culture. Do we not have that? You go to the village and ask them how they make love, they'll laugh at you because they do not necessarily have to kiss. She just know that it's time, it's time.
It's time.
And she's in
Switch
the
on.
mood. Yes, and she can come and say, okay, I feel like, and the man, so really, and they go. You understand? So it's a cultural thing. Culture is there, a factor. We can't take that away. So you see, so that's also a factor. And sometimes you don't understand. Most of these people do not understand what stimulation means. You understand? They don't know that you have to be patient, and sex is supposed to be enjoyed by both parties. So they don't understand some of these things. So yeah, that's also a cause, common cause. Also, we have causes that's pertaining to diseases. Yeah, so we spoke about fibroid in passing before. It's also a cause. People with fibroid experience painful sex. People with ovarian cysts experience painful sex. People with adenomyosis experience painful sex. People with cervical cancer, for example, cervicitis experience painful sex. People with cystitis also, bladder infection, experience painful sex. So we would say, okay, it is anterior wall of the vagina in this stand, side walls of the vagina in this stand. So people have what we call vaginismus. Vaginismus is soreness of the muscles around the vagina in layman terms in this stand. So it's also a cause.
So what causes it?
STI could be a cause of vaginismus in this stand. So which is the commonest cause, yeah, of vaginismus, STIs. And sometimes in some persons there's no known cause. It just happens over stimulation. Some other persons have trauma. Trauma is a cause of painful sex. They've been abused before, experienced traumatic event that pertains to sex. You understand? Some have been molested, female genital mutilation. You understand? So that could be a factor also. Now, so when we say fibroid, people wonder, can fibroid cause painful sex? In this time, you get this, we call them intraperitoneal causes. Like they're in the abdomen, but there's weight that comes down in this time because of the constant thrusting. In this time, you feel pain because the cervix is down where it's not supposed to be. In this time, image also, yeah. So there's it's in with sexual positions, also different sex positions and all of that, experiencing pain during any of those sexual positions because it's also a factor.
Sexual position.
Yes.
So which type can cause pain, Dr. Sam?
Different strokes, different different experience. Yeah, different stroke, different experience because you know, for men, we said we counsel men and tell them that the missionary is better for you. It's safer for you.
Because Dr. Sam, do men feel pain?
Yes, I don't understand. Yes, it's possible.
I thought it's
Penile fracture is a thing.
Okay.
Penile fracture is a thing. Also, yeah. So it's not very common, but then some people do feel pain because of the sex position and all of that. Yeah, so for women, sex position is it's in you have a partner rather who has a very big penile shaft, for example, in the stand, and he is
Dr.
thrusting
Sam,
in
what is penile shaft?
penis.
Help our listeners to understand what you're talking about.
So yeah. So for such person and the lady is on a petite size, for example, in the stand, I don't think doggy is a best position for you because it's going straight to the cervix. So you could experience serious pain because of that in the stand. So yeah, so sex position also matters for the person. So yeah, it has to do with partners understanding themselves and coming to understanding of some of these factors. So usually when you come to the hospital, we have questionnaires we give to you. You feel from there we're now able to dissect and counsel you appropriately based on of what some might need physical therapy, some just psychotherapy, and some surgical therapy, depending on what the cause of the problem is. So, for postmenopausal women, that is usually due to hormonal change or shifts, as we may put it, because serotonin is supposed to help with all the what they call it lubrication down there. In the sense, serotonin, norepinephrine are hormonal neurotransmitters that help with that. So there's a drop in some of that. So some of this lubricants contain serotonin. That's why we do not advise pregnant women to use such lubricants. You understand? Because of the content of the lubricant. So for postmenopausal women, one of the lubricants will tell them to get serotonin containing lubricants so that it can help stimulate and increase lubrication down there. That's for postmenopausal women. For people with trauma and all of that, we refer them to see the psychiatrist, to help for psychotherapy and all of that. People with other issues, we take care of them, and it goes back to normalcy. So you have to understand there are people who, from the onset, have had painful sex. There are other persons who did not experience painful sex, but started experiencing painful sex. Understand? So the approach consideration for those two persons differ a lot. So yeah, one of the things we encourage women to do when they come to, is to speak and understand. The reason why we give questionnaires is because women may be shy.
It's hard
to say this is my experience. This is my experience.
We need to break that silence.
You have to give that, and sometimes the environment is not conducive. So we try to set the stage, tell them stories about this, about that. This person A, person B experienced this. So give that atmosphere for people to talk and be able to express themselves, basically.
Okay, so please, I need clarification on this. There's this talk about some women on the big side having, is it short vagina or cervix, and so they feel pain, and then for those that are slim, they have long vagina or long cervix, and so when there's penetration is very deep, and then it's kind of deep and loose, and so I need I know it's not the main discussion, but I think we would love to get clarification on that.
Now, the vagina is supposed to be about 7 cm long, basically. If I'm not mistaken, say between 5 to 8 centimeter long. That's what we say usually, yeah. But size by weight does not determine the length of the vagina. So if you have a short vagina because you've lost weight, it doesn't mean it's going to elongate. It's follow come. That's how you are. It's like you add weight. No, you add weight. Now, when you talk about short cervix and long cervix, it has nothing to do with sex. You're talking about being able to carry pregnancy, basically.
So it doesn't have anything to do with body count. Because some people say when it is shallow, loose, it's body
not shallow.
Count.
It's not shallow. It's not shallow. You can say it's loose. Yeah, partners say there's laxity of the vagina. They don't say loose. It's lax. A lot of factor. So the vagina is elastic. So yes, frequent sex and all of that would make it supposedly lax in some persons. But what makes it lax most times that we don't talk about is the use of sex toys. Yeah, because the body will adapt to what is frequent there. Understand? So you're using a horseshoe as a sex toy.
Horseshoe?
Yes.
Okay.
Using a horseshoe as a sex toy, you understand? You do not expect the normal penis to fit in anymore. Do you understand? If your previous partner was endowed, say, as opposed to your current partner, it's like your current partner
endowment is a gift.
Yeah, no, talking about factors, that to cause that. So if your previous partner, as compared to your current partner is not as endowed in that term, as your previous partner, is going to complain of laxity. After a while, it's going to accommodate. In some cases, childbirth could be a factor. Understand? So people,
is it in some cases or all cases?
It's not all cases, though. It's not all cases. In some cases, because it's not everybody that complains of vaginal laxity after childbirth. You see, the only time where it's constant is in grand multiparous when we're giving back to 7, 9. You understand? Yes, definitely.
That's not common.
You say what?
7, 9, is it common?
Don't say what you don't know. It's common. People, it still happens up to now. It still happens.
Dr. Sam, a woman will push 1, 2, 3 to 9.
I've even seen 19.
What happens to CS?
Yes, that's a topic for another day.
Yes,
But
and we'll certainly discuss about that.
People have, there are women who have given birth to 12, 13, people have been pregnant 17 times, and yes. So,
No, I don't mean
they've given birth to all of them. Yes.
like at the same time. 1, 2, 3, 4, 5, 6, 7, like twins, triplet.
No.
Okay.
No, I don't know what I'm talking about.
Okay.
I'm talking about different
pregnancies 7 times, 12 times. Okay.
People all their life they've been giving birth.
Oh,
making
well
babies
done.
all their life.
Well done.
There are different people like that. Yeah, people like that. So yeah, definitely. So for such persons, yeah, it's a factor. Yes, and it's a factor. For in such cases, you go to hospital, come to hospital, we'll do vaginoplasty for you, reduce the size and make you a virgin again.
Dr. Sam, today you're making me laugh. So why did people advise her to do family planning instead of the vaginoplasty?
Family planning is advocated by all practicing physicians to everybody, but then it is left for you,
culture and religion
yes,
again,
to accept. That's why I say you can take yours, but we can't force it to drink water. So there's no way you can do that. One doctor was killed in Medjugorje some years back because he advised the woman on family planning, and the man came and killed him because he wants to take over his household. So there's some of these topics that would shy away from in Islam, but then we advise you, counsel you that do family planning, use condom. Some say it's a taboo. You should use condom. In some sects, even in the church, you're not allowed to.
Your gender said it reduces the enjoyment now.
Yeah, then do vasectomy now.
Men do kidney.
No. See, it has to do with legislation and understanding. I like this topic. Do you know why? In the US, that was 2 years ago, when abortion was scrapped. Now, more men went for vasectomy.
Okay.
Because there was nothing like, what they call it? There was nothing like abortion anymore.
But our climb here, we like children.
Yes, in Nigeria, abortion is a crime. It's already. But men will not go for vasectomy because they are blessings from the Lord. Do you understand? So you see,
Dr. Sam, this is your gender.
no, children are blessings from. That's what we say. That's why we give birth to 10, 15. So when you advise people to do family planning, they say no. It's not. Even some Christian sects strongly frown at family planning. They do not allow it. They say it's a sin. Okay. Because man was made to procreate, so therefore go into the world and
Dr. Sam, it's not a sin. It's not a sin because we are the ones at the receiving end. So if a man wants to give birth to 20, he should have like 10 wives, 2.
Will you allow for your husband to have 9 more wives?
It is well, Dr. Sam.
So yeah, like I said, it's a cultural thing. So yeah, it's not definite. It's not definite. You can't put and say this is that. No. Yeah, there's no hard and fast rule to it. Basically, when it comes to these topics here, what we can tell you from a medical point of view is that, for example, having more than 5 children is a risk factor for you as a woman. You could die at the 6th or 7th one. So we do not advise you to have so many children.
Through vaginal delivery.
Whichever way.
Yeah, because some people tell you that through vaginal delivery, you can be dropping. Then for CS, even when doctors advise maximum 4, they'll still tell you that I know one auntie that give birth to 6, all CS. I know one that give birth to 7, all CS.
Yeah.
So we really need to educate our women and of course the men, because men are not helping, because when you don't want your wife to even use condom, that it reduces pleasure. Certainly, pregnancy may happen. I don't
No,
want
not
to
me.
say
It will
will.
happen.
I'm careful not to say will. I'm careful not to say will, because
Yeah.
this natural method of counting calendar, it doesn't work, but thank
Well.
you. Let's
Oh.
move forward.
Yeah,
Dr.
okay.
Sam, today is me and you. So in an event where lubricants fail, what's the next step?
You come to us.
You
Come
want
to the
us to
hospital.
bring money to you.
Of course,
What
come
can we
to
do
us. Pay
at
for our
home?
services. No, you can't do anything at home. Come
Okay.
to the hospital. Yeah, you go to the hospital first. Like I said, there are lots of causes
Okay.
of painful sex. Do you understand? A lot of causes. So you do not know what has caused yours.
Okay.
That's for a fact. You can only guess that it may have been as a result of dryness. Now, when you come to the hospital and you start checking your neck to check for your thyroid, and you say, what's in concern that my neck and
And
vagina?
vagina.
Listen, you're asking questions. You know, on social media, I say I went to the hospital. Doctor started checking my neck. What's in concern neck and this? But it was that I went to school to study this thing. It's not you. You understand? But you could have a thyroid disease that is going to affect stimulation, loss of interest. Do you understand? People with thyroid disease, for example, they are dry. And it's one of those instances where you say, what took me to the hospital is not what I was diagnosed with.
What I ordered versus what I got.
Yeah. So for such a thing, there's no way you're going to be in your house and you're going to know that you have a thyroid disease and it's causing you to have that. Now when you come to hospital, you now start treating that, you now start seeing results. Something like a thyroid disease, now you start treating and you not see results immediately. But after about 3 months, start saying, oh, there's improvement, you know. So you don't know what has caused you. So you come to the expert, then we'll tell you what is wrong with you. Because top of my head, I can give you 20 causes. You understand? So how would you know those 20? Do you know if you have adenomyosis, you have a fibroid, you have cervicitis, if you have a cervical cancer, if you have a vagina, do you have a syndrome with the anterior wall, do you know if you have cystitis, do you have bladder syndrome, do you understand? Do you know if your
Endo.
clitoral wood is there? Do you know if you have a thyroid disease, for example? Do you understand? Is there a sort of post-traumatic event? Is it psychological? Do you understand? So is there a mass in your abdomen? You understand? Is it a cyst? Is it cystitis? Do you understand? Is it hormonal imbalance? You understand? So, I mean, we're just giving you 16
Ah,
now.
don't scare us. Dr. Sam, thank you very much. So all we're saying is that pain is not normal
No, it's not normal.
and we shouldn't ignore it.
No, don't like ignore it.
It has explanations.
Yes.
Okay. So let's talk about solution. When a woman is experiencing painful sex, what are the treatment options?
The first thing a woman should do when she's experiencing pain during sex is to go and see a doctor.
What type of doctor?
See a
No, you put
general,
a many.
see a general practitioner first. Because your problem might just be STI.
Okay.
And just treats it for you. But then if you must, see a gynecologist. Then if it's not a gynec issue and it's psychological, we'll ask you to see a psychiatrist.
Yes. In
You
part
understand?
2, we'll be discussing the mental health of painful sex. So
Okay.
the mind body connection. So that's also very
Important. So
important.
yeah, that's good. So you come to the hospital, then we start to break it down and find the root cause. So we start with questions, say ask you questions, give you questionnaires you feel. From the questionnaires, we know where you're at, so we'll pick it up from there. You ask questions. At what point do you feel pain? Is it at the beginning? Is it during? Is it at the end? So we start to explore. I had a patient one time that had something similar. He had painful sex was after sex. After sex, yeah. So then I told our partner to look at the vulva after sex. And after sex, it's called that she had lots of bruises after sex. But lubrication was not a problem. You understand? So they started using lubricants and all of that. I asked them to check. They checked, didn't get back to me. They found the solution for themselves. They started using lubricant, but it did not work. But then, when he came back, now discovered that he had a vitamin E deficiency. Yeah, he had a vitamin deficiency. So simple, just get vitamin E, put on top of it, and it won't use, and that was all. You understand? So
Dr. Sam, we need to be louding this thing. Vitamin what, please? Okay, now.
So you see, like I said, we are the experts, so we know what to do. So you can only guess.
We don't doubt that.
It's like you don't, so yeah, no matter what it is, you come. So, for example, you could have it upon at the peak of sexual activity. So probably the cervix is sensitive, so you have to know what's wrong with the cervix. Is it just an infection, STI that's causing it? And sometimes that's the earliest cause indication of cervical cancer. Do you understand? It's from painful sex. And are you bleeding? Sometimes we bleed, sometimes we not bleed. And I say, come, let's do a biopsy. You do, and it's early stage cervical cancer. And so come, let's cure this thing before it goes further than this. Do you understand?
Yeah.
So we'll do physical examinations for you. That's vaginal examination. You understand? So we say we use our fingers to check and all of that. So yeah, you check. And
Somebody said it's enjoyment.
it can never be enjoyment. It can never be enjoyment because it's necessary. So most times we use what we call a chaperone. Somebody is there in the room when doctor is examining you to check that, So signs we look for, like cervical motion tenderness, let us know that okay, this thing is not just here; it's from the abdomen, maybe the cervix, So we'll now do a speculum, put a speculum open so we can see. And see, I can see a mass, see a polyp, for example. I will see a wound, there's soreness there, and all of that. But when trying to put this speculum, you can see that signs of vaginismus, for example. So, okay, this is the cause. Understand? So, we're examining from outer inwards, outside. Then we'll do imaging studies also. We'll do it ultrasound, transvaginal scan for you, check. It's clearer. We'll see if there's anything in the abdomen that's causing it, if suggestive or something like that, for example. So, yeah, do TVS and see a big cyst. I mean, there's no way you're going to not have painful sex when you have something that big in your abdomen resting there, because you're thrusting in and it's moving, so the pain is there. And some people have neuropathic pain, neuropathic pain. Some patients who are diabetic, hypertensive, could be experiencing that. I will need to place them on medications that will help put them back in shape to help with that. So basically, that's what we'll do for you in the hospital. You come and we'll try to. And for the very few cases, about 2 to 3% of such cases that are idiopathic, you don't know the cause. Maybe
Unknown.
Yeah,
I heard that a lot in school.
Say
Unknown
it's village
origin.
people, but somehow we tell you to pray to your village people to let them leave you alone.
I wanted to say unknown origin. Aisha is not witches and wizards. Spiritual.
And then sometimes we go. So, but for the ones we think are idiopathic, I've come to realize that most of them are psychological. Now, because emotional distress is also a factor. Emotional distress, not being in right emotion, stress, depression, all of those things are there. So sometimes we overlook these things. We cannot pick these signs up. And, like I said, the mind is the greatest sex organ. It's, everything that happens is controlled by the mind. So yeah, if the mind is sick, the whole body is sick. Understand? So yeah, so it's one of those factors that we tend to overlook. We tend to overlook such factors. So yeah.
So how long does treatment typically take?
Treatment is
yes.
Treatment is tailored to individuals.
Okay.
It's tailored to individuals. Depends on the cause again. If it's just STI, they'll treat you for 7 days. Yeah, good to go.
And the woman has to stay off sex.
Definitely, both partners are treated.
Okay.
Both partners.
No, I mean for even other conditions, they have to learn how to.
You'll be off sex for that 7 days and 5 days afterwards. for you to see any good improvement. So yeah, so that's one of these factors we ask when people come. We ask you, are you having sex with a man? Are you having sex with a woman? Very important because different ailment for both parties and different kinds of disease for both parties. First, secondly, is it one person you're having sex with, or is it with everybody? And most times you ask the husband to go outside. It's only when you sleep with your husband that you have painful sex. Or you have a lover and you sleep with that lover, you don't have painful sex. You know that that one is the mind. So yes, it's also a factor. It's a big factor that we ask. So because we tend to accept the mind. So yeah, room for men also, it's the same thing. They ask, you don't enjoy sex when you sleep with your wife, but you enjoy sex with your side chick. So yes, it's not your wife. You are the
Okay,
problem.
side chicken and side cockerel.
Yeah. So it's factor. So you have to understand those factors. Also, it's also plays a role in how long. Because, for example, if you have multiple sexual partners and you come with your partner, come with your husband to a clinic, and will treat both of you, it will disappear momentarily. It will still come back because the partner who has not been treated. So that's why most times we say that if you have other partners, to both couple, kindly tell them to treat. And they come and say we're insulting them. I'm not insulting you, we're just advising you to help the public
Advice, no
health.
be insult.
It's not an insult. It's just advising you, just in case, for your own, whoever needs to pick the message will pick the message, but we'll not fail to tell you. And so we're not judges, we're not pastors, we're not imams. It's not in our power or in our place to judge you. Whatever it is you want to do, it's your life. You're doing
So you
it.
listen, you don't judge.
Obviously,
You listen and treat.
you just treat. That's our rule. Our primary role is to treat.
Okay, Dr. Sam.
Yeah.
So let's talk about pregnancy and sex. Is it mandatory for a pregnant woman to have sex? Like, must a pregnant woman have sex?
You know what? When you say mandatory, I just like there's a law that says you must have sex during pregnancy.
Okay, so there's no law,
I'm
but
not aware
is
of that
it
law.
commended for
Pregnant
pregnant
women.
women to have sex?
Of course. Of course. The only time we counsel pregnant women not to have sex is will be in the early trimester when they all get pregnant. For those with certain conditions, for example, you be married for 5, 10 years, you've not had a child, then you get pregnant. We tell you not to have sex during that period, and let's be sure that the baby is going to stay.
Okay.
Do you
But
understand?
some men will tell you that the penetration does not affect the baby. The baby is in the womb.
Okay. Yeah, that's a precious child. Yeah, ordinarily, if you're having safe sex, or being safe sex, you're not turning the woman upside down and not doing any of those gymnastics or gymnasium, we call it, people are doing. It should be safe. Sex is safe during pregnancy. When sometimes we tell you not to have sex during that first trimester, let's hold that baby. You have a woman who has had incompetence, has been having miscarriages and all of that. I don't want you to be having sex with her in the first trimester. Once, for example, want to do a sacrilege for her when we've confirmed that pregnancy. We'll do the sacrilege, keep her for a while. After 2 or 4 weeks, you can have sex, safe sex, you can have sex. The woman will want to have sex during pregnancy. She will also crave for sex during pregnancy. In this sense, so will you not deprive her of having sex during pregnancy? No, you would not. In this sense, so yeah, at late pregnancy, towards the end of pregnancy, late trimester, when baby is term for labor, women are encouraged to have sex because it helps in simulation of labor and what's not in pregnancy and all of that. So yeah, so
It
there's
makes
no
the
law.
baby to arrive.
It just helps bring about labor sometimes. It
Okay.
helps her bring labor sometimes, basically, but doesn't help me become faster. Until you see people say after sex, start feeling symptoms and stuff like that. Yeah, things like that. So yeah, it's okay. That's it. Doesn't make me come out faster. It doesn't do anything as regards baby coming out faster or not.
Okay. Thank you. Dr. Sam, women are told to submit every day, submit their bodies in season and out of season. Whether they are menstruating, they are tired, they feel like it or not. And our men are earnestly expecting this submission. Ye in what? Ye out. And in this era of beautiful sex, I'm sure you've heard of those kinds of preaching online. Beautiful sex. But nobody really talks about the pain the woman feels. So I need you to address this issue. Speak to the women, speak to the men.
I
Because,
feel like a pastor now. Amen.
amen.
So yeah, this is why I started by talking about sex being a behavior, a culture that is meant to be enjoyed, not to be endured. And there's paucity of knowledge when it comes to sex because we shy away from talking about sex a lot of times. We do not have the appropriate sex conversation. What do I mean by appropriate sex conversation? We talk about sex being a duty to newlyweds, that's to the women. We do not discuss with men that is also a function to make sure that your partner enjoys sex. And the truth is this: most times, men bring their wives to hospital to complain that she says she feels pain during sex. She says she doesn't enjoy sex. After counseling, men come back to complain that their wife are asking for it too
Too
much.
much. Okay, now.
Do you understand? So you can see that this is a clear misconception, one, miscommunication, lack of understanding, understand, and a societal problem we have in this part of the world because we don't discuss sex. They don't know. The woman herself doesn't even know her body. She doesn't even know that she has a clitoris. That is one of that is very essential for sexual stimulation. She has no idea about that. So the construct is for first of all is for the woman to understand her body. That's why we now come to topics like 80 to 90% of women will never experience an orgasm in their lifetime, because in first, what is orgasm? Listen, they've never experienced it. They don't talk about because people don't now. Advent of social media, we begin to see posts about orgasm existing and things like that. So begin to wonder what is orgasm? What do you get? They enjoy sex for a vast majority, but they've never experienced the climax of sexual orgasm, and it's because they do not know their body. And so a woman cannot know her body without the help of her partner that will explore her body. So can two work together except they agree?
No, Pastor.
Thank you very much. So both parties have to agree and have an understanding that you have to walk me through this process. If one is more naive than the other, and both parties are naive, they have to go and seek help to walk them through sex education. So we spoke about appropriate sex education the last time we were talking about for different. Now at this point in time, we're adults, married couples. You understand? You have to let them know. You have to be raw. Tell them this is the vagina, this is the penis. There's no need to code it and say this is your banana and whatever. At that point in time, you have to explain. These are the parts of a woman, body parts of a woman. These are the body parts of a man. This is how to stimulate your wife. This is how to stimulate your husband. For men, it's simple. They say it's pump and shoot, parasympathetic and sympathetic. Once there's an erection, there must be an ejaculation. Does not mean they will enjoy it anyways, but then that will be the end of it. So for a woman is a complex of hormones and emotions all combined together. You have to be patient. You have to do this at this point in time. You have to do that at that point in time. You have to walk her through that process, especially for a lady who is very naive, has never experienced some of these things before. Now, it's the onus upon both partners to work themselves and experience a good sexual life. Now, why do I say it's upon both of them? Because there's a possibility that both of them have had previous relationships where they all had fantastic sex. Now, one issue we have is that everybody wants to appear holy. to the other partner. So they do not want to share that this is what I enjoy most. Because the question is, how did you know? You understand? So that's a fundamental problem. And I say, okay, this is what I enjoy, but my partner doesn't like this. And I don't want to talk to my partner about that. But then there is no magic that is going to make your partner know that this is what you want
But
or what you experience.
when the man is asking, how do you know?
Yeah, that's what talking about. That comes to the fabric of the relationship, where people say, okay, I've not been so many persons before. I've never had sex before.
Okay.
I was raped. I was that. I
Inexperience.
was inexperienced. Do you understand? Things like that. You get the woman can also ask the man, we have been having sex like this for the last 10 years. So what changed? That means you're seeing somebody else. Do you understand? But it's possible that he has just been enjoying or she has just been enduring. It's like I just
Yes.
finally got to speak
To
up.
speak up.
You understand?
Yes.
Stuff like that. So yeah, that's why we talk about they say we should be reflective. Step partners be reflective after sex. He asks, did you enjoy the experience? Did you not enjoy this experience? It's like, okay, yeah. So because I don't want to bruise his ego, I said I was enjoying it. Well, bruise the ego, I enjoy it now. Because if you whatever it is that it was doing now, and it's asked, did you enjoy it? Or you said yes, you did. Is what you're going to be living with for the next couple of
I
time.
heard some people fake orgasm.
Yes, it's
So
a
when you
thing.
fake orgasm, how do you now settle some of these issues? Because when the man,
Feels like
you don't
yes,
want to bruise his ego, and then you're saying, yes, I enjoyed it. Meanwhile, you're enduring pain.
because it has now become a form of duty to understand to help the man feel like he's doing well. Yeah, usually studies have shown that there's some studies we've done before that was I think 19th century, but then the history of faking orgasm was commonly in sex workers. Yeah, was seen mainly in sex workers. So we didn't not really done any study about sex and all of that in Nigeria or Africa. I've not seen anyone. Maybe I've stopped reading, but I've not really come across anyone. But the ones I've read about before, they're done, in the Western and European world, and it's alike. You can relate to them what is being said and how it relates to day life. And movies about them also, I think that will show that. So yeah, for people who fake orgasm, it's a sorry case. A sorry case because some of the people who fake orgasm, they've never experienced orgasm themselves. So
Or do they even know what
an orgasm is.
it
That's what I'm
means to?
saying. They don't. Some of them they
They don't
don't
even
they
know.
don't know. You understand? Because there's no way there's no way you can fake an orgasm successfully to a man who has
An
had a woman.
experienced.
Yeah, he would know. Probably just play along. You understand? So yeah. For some people say this is from studies that we've done. Some say some sex workers boasted that they're expert at doing it. But for them, they're being paid for it. So yes, they are paid actors. So they're acting at that point in time. So it's understandable, but not for somebody you have that emotional connection with. It's difficult to do.
Okay. Thank you so much, Dr. Sam.
Thank you very much
As we
for having me.
conclude this segment, I know of a lady who has been experiencing painful sex. All I hear her say is she's fasting and praying about it and seeing a doctor. Mbanu. From our conversation today, it's clear that the solution to painful sex is not just prayer and fasting.
Definitely not.
Now, this is not to belittle fasting and prayer, at least from a medical perspective. I strongly believe in both. In fact, I believe in God, and I believe that what God cannot do
Does
does
not
not
exist.
exist. However, wisdom is profitable to
Direct.
direct. I want to be like you. So, Dr. Sam, what's one message for women experiencing painful sex, like my friend,
Speak
who
up.
is relying on prayer and fasting?
Speak up. Go and see your physician also, so that it can help. No, prayer is good. fasting is good, edifies the body and sanctify the spirit. So it is said. Yes, however, I remind you that when Jesus was picking his disciples, he picked a doctor to be his disciple. So just understand that it was not done in out of it's not just a mistake. It was done, it was informed for you to have an understanding. That's why Luke was picked.
Yeah,
In the
Dr.
book of
Luke.
Luke, you see that he was talking about medicine also. Medicine and the scriptures are not far apart. Yes, and even if you're not a Christian and you believe in Islam, you read the Quran also, you see places where medicine was advocated also. So those two can work together. You can pray and believe in God, and God can open the eyes of your doctor to see your
To see
problem.
the problem.
Yes. It may not be your eyes, it might be God. So, but your pastor will not say, come, let me examine you. You will run away. You should run away because that's not his job for you. So, first thing first, speak up. Speak up to your partner. Make him understand that you feel pain, the process is not enjoyable. Seek help. Come to the hospital. You understand? And when you come to the hospital, your doctor will attend to you. When people come to the hospital, we use a please model. Please model is what it means is that we ask for permission. P there is permission. Permit us to ask you and your partner what your sex experience is like so that we can help you. We'll listen to you with intent of providing solution to you, and intensive therapy will be given to you. That's what ends it, implicit therapy. So that we use that model because it's a sensitive issue and it can make or mar a relationship. So it's very important. So yes, we urge everybody experiencing that to speak up to their partners, seek help, medical help, not spiritual help first.
Okay.
Thank you.
Medical help before spiritual help.
Yes.
All right, Dr. Sam. Dr. Uko Iko-Ojo Samuel.
Thank you very much. You
I
got it
got
right.
it. Thank you for this. In fact, today you made me laugh. I just had to control myself, and I have a lot of questions for you. But let's leave it at that.
No problem.
Thank you for coming on Their Body and Mind, and thank you for discussing this sensitive issue. Thank you for dissecting it.
Thank you very
Yes.
much for having me
Thank you
today.
for not speaking too much big medical grammar. You wanted to tell us phallux, phallal, what appendage.
Financials.
Thank you very much for coming.
Thank you very much.
I'll see you soon.
No problem. Thank you very much.
Today, we have learned something powerful. Pain before, during, or after sex is not a spiritual weakness. It is not stubbornness. It is not a lack of submission. Sometimes it is hormonal. Sometimes it is an infection. Sometimes it is a muscle tension. Sometimes it is a diagnosable medical condition. The body whispers first. If we ignore it, it tightens. If we still ignore it, it hurts. And enduring pain in silence doesn't make you stronger. It only delays healing. If you are experiencing persistent pain during intimacy, see a qualified medical professional. Ask questions. Do not feel ashamed. Pain is information. But here is something we must acknowledge. What happens when medical tests are clear, but the pain remains? What happens when nothing physical is found? What if the body is reacting not to disease, but to fear, shame, pressure, or unhealed trauma? Because sometimes the body is not broken. Sometimes it is protecting. In part 2, we will explore the mental and emotional layers of painful sex. If you have ever endured pain quietly, if you have ever felt ashamed of your body, if you have ever wondered, what is wrong with me? Part 2 is for you. This is Our Body and Mind, where real conversations heal. Thank you, beautiful people, for joining me on today's episode. If today's conversation resonated with you, please share it with another woman. Like and follow us on all our social media platforms. Subscribe and turn on notifications so you don't miss out. And if you'd like to share your story, we'd really love to hear from you. Just send us a message via our Body and Mind podcast at gmail.com. And remember, your body is wise, your mind is powerful, and your journey matters. Until part 2, keep thriving. I love you.